You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering dental implants. With us, we have an expert on the topic, Dr. Don Ross. Dr. Ross, welcome to the program.
Randy, it's a pleasure to be here.
Now, I know you brought some photos, and we have a lot of questions about who's a candidate for dental implants and the process. Before we get into today's topic, fresh start. Now, you want to be, your goal, according to this, that you want to be Colorado's premier provider of dental implants, exclusively dental implants. Tell me about that.
Correct. Fresh Start is what we want to do is we want to provide an experience for patients that is second to none in the terms of from beginning to end and delivering predictable results that are going to last a lifetime. And we believe that our processes are set up to provide that. Okay,
now you like dental implants.
I love dental implants.
I like your story. You're telling me in the green room, I said, when did this all begin? Tell the story. It's like an epiphany or something.
Yeah, right. When I was a junior dental student at the University of Iowa, I had a privilege of doing one of the first cases as a student. Dental implants at that time in the student curriculum was not available to the students. I lucked out really and got this nice lady who, she literally tells me, why have I waited so long for this procedure? I mean, she had dentures for 40 years.
Okay.
And this is something where a dramatic
Why did
change.
she wait?
You know, I don't remember why she specifically waited, but I can tell you why most people wait. And most people wait because one, they don't know about the procedure, but two, they don't really understand the benefits that it can provide for them, and what a difference it makes in terms of their everyday function. They eat better.
What about pain, though?
Pain, I think, is a big misconception with dental implants. This particular patient, very minimal postoperative discomfort. We give patients pain medications to take. It's a surgery.
Yeah.
And most of them,
they don't take it.
They don't even take them the day after. Usually nothing.
Nothing.
Usually they'll take some ibuprofen,
okay.
and that's it. Most of them are really surprised at how the discomfort is.
But how did this? Okay, so you're a young student, right? And how did this change everything? I mean, what was it about it, I guess?
Well, for me, gosh, I sat there and I saw the difference that dental implants made with this lady. Here's, again, veteran denture wear, limited in what she could do, limited in what she could eat, and seeing her after the implants, I just told myself, I got to learn more about this.
So your background, your training, let's talk a little bit about that. In regard to dental implants,
I chose to pursue the course of prosthodontics, which is the specialty.
What is that?
After dental school.
So you're a prosthodontist, right?
Correct.
Okay.
Yeah. All that is basically I went to dental school. After dental school, I did an additional 3 years of strictly focusing on how to replace missing teeth.
Is that right? Okay.
Yep. And which involves dental implants. And I got into my education and just found a passion with dental implants.
You love dental implants.
Absolutely love dental implants.
It's like addictive, you say.
Well, what the addictive part is not necessarily, the science and the artistry is nice, but it's addictive in the sense of you see what it does for people. And I've experienced this enough now to where there's nothing like it. When you see a patient that has struggled, what they struggle with is loose-fitting dentures. They are dealing with sore spots. They're dealing with adhesives, messy creams they're putting in 2 or 3 times a day. Patients that are worried about smiling, laughing, eating, sneezing, okay? And they're worried about the
Is this what they tell you, by the
out.
way, on the consults?
Yeah, this is pretty much common in every patient that comes in. I could, in a nutshell, there's probably 10 different problems that people struggle with, but that's common across the board with most people. Now, there's a very few percentage that do okay with dentures, but most people, this is everyday living. Food caught under their dentures, it's a constant worry, and really the result of that is people kind of lose out on life. I mean, that's what we find out. They don't smile.
Just because of their teeth?
Because of their teeth.
Okay, now of course you're a dentist, you think that the teeth are pretty important.
Well, of course. I personally have never experienced these problems for myself.
Okay.
But every day I see it, and the common things are patients don't eat, they avoid situations, social functions.
Interesting, very interesting.
And so really,
So it's like getting your teeth back.
Yeah.
I mean, is that right?
Yeah. The reality is we can talk about teeth. That's kind of what I do.
Yeah.
But what I'm really selling, if you will, or what I'm really providing or offering people is really, when it comes down to it, it gets their life back.
Now, one of your taglines, no more dentures. Do you believe that? I mean, is that the future? No more dentures?
Absolutely. Dentures really are a thing of the past. If you look at what dentistry can provide, 21st century dentistry can provide today, there's just no reason for dentures. We can do so much better in terms of what they provide, how much healthier people are with them, what they can eat, how they feel about themselves. It's a complete different world, and I love it. I see it every day.
So you're a prosthodontist, you're a specialist. I mean, is it about the same as far as pricing? Do they need a referral from a general dentist to see you? And is it about the same price, no matter whether you go to a specialist or a general dentist, maybe?
Yeah, good question. One thing is I do work with a lot of dentists that refer patients up.
Okay.
But you definitely don't need a referral to come to our office. You can contact us directly. You can visit our website. There's several ways you can get into our office.
Is it a free consultation, by the way?
We do offer a
Put you on the spot?
complimentary consultation, yeah. I mean,
Do they hate going to the dentist still, by the way?
Every person that comes in says,
Because you don't look like a dentist, by the way.
Oh, I don't
Do
know
you
what
hear
a
that?
dentist, I don't. I don't know what a dentist is supposed to look like. All I can say is I am one, and
But do you hear that, though, that I don't like going to the dentist? I always ask dentists that. Do you hear that?
I hear that a lot. A lot of patients that come in, it's very common for people to, we'll kind of get into this. It's a good question. A lot of patients don't come into the dentist. Most of my patients haven't been to the dentist for 5-10 years.
Okay.
And so there are certain reasons they don't come, whether it's fear, whether it's they don't want to hear the truth of what I'm going to tell them. But for one reason or another, they've given up on dentistry. And something makes them come in, and when they do, it's important for us to find out what that is and how we can help them. And
So let's begin with the different categories of dental implant patients that you see.
basically, there are a few patients that a few different categories that people fall into. One, they're either missing a single tooth, whether it's in front or whether it's in back.
Okay.
There are patients that are missing 1 to 4 teeth. Okay, they could be anywhere from all over the mouth, or they could be somewhere right in a row.
Mm-hmm.
And then there's the patient that is missing all their teeth. And those patients are either denture wearers for the first time. They've been wearing dentures for 1 to 12 years. And then there are people that have been wearing dentures for longer than 12 years. And the other category I would say is there are a lot of patients that are about to be missing their teeth. And this is a key patient.
Why is that?
Because these are the patients that really don't know what to do. They're in a lot of pain. They're worried about dentures. People tell me all the time, I don't want dentures, doc. I fear dentures, and I know if I lose my teeth, I'm going to be getting dentures.
Okay.
And that's kind of the mindset. And these people we want to get to early so that we can find out which teeth are worth saving.
So, by the way, how big of a problem is like denture wearing? I mean, how many people are out there with dentures?
That's a great question, because what we know through statistics is that we've got about 20 million people in the United States that are missing all of their teeth.
Wow.
And then you add another 12 million people who are missing all their upper teeth. And an interesting statistic I found recently was that there are, by the time the average American reaches age 50, they're missing 12 teeth. And so you have this group of people out there that are missing 1 or more teeth, 1, 2, 3, 10, all their teeth, and a lot of them don't have answers. What do I do? They don't want dentures. They don't want the adhesives. They all have parents who, or grandparents who've had dentures and saw them with what they struggled with, and they want answers.
But if dental implants are as good as you say they are, you say 2 dental implants can give a denture wearer something that is secure, snaps
Correct.
in, snaps out.
Yeah.
If it's as good as you say it is, what's your take on why they're not all doing it? Lined up to get dental implants.
Right. Well, there's a couple reasons. One, people aren't going to the dentist. A lot of these denture patients, they get their dentures, and that's the end of the road for
That's
them.
a good point. Okay.
Unless they've got a serious problem, a serious sore spot or something, they just don't go. Well, another reason they're not coming to the dentist is that a lot of people just think there's no hope for them. They either think they're too old, or
The denture wearers.
The denture wearers.
Okay.
Yeah. They've just given up on dentistry. They don't think they qualify, or they don't think they have enough bone, and it's just completely false.
My mother, and I've told other dentists this many times, she's 74, pretty healthy. Mm-hmm. She says, Randy, because I tell her about, this topic, we talked on the phone, and she says, her medical doctor said she's too old at 74, that the dental implants will fall out. You know,
Oh, not true.
Really?
Not true. Not
Okay.
true. Absolutely not. We've had,
But I was thinking, I mean, do a lot of people think this?
you know, I don't know. I think a lot of people do. All I can say is in my practice, I have people from all age groups.
Like how old? How old can you be?
I
to
think
get
the oldest one we've done was in his 90s.
90s. Why would a 90-year-old want to get dental implants?
I'll tell you, what I say is I tell people all the time, if it's a quality of life issue, how are you going to spend the next, even if it's 2 years? You know, 2 years is a long time. And if you're going to wake up every day not eating the food you want, not smiling, not doing some of these things,
Interesting. Okay.
what is it worth? What is that worth? That quality of life for whatever, however long you're going to be living, whether it's 1, 2, 5, 10 years, it makes a big difference.